My name is Tom Stoney. I'm one of the urology registrars at St George's. This video discusses your upcoming stent insertion procedure. This procedure is usually performed by Mr Anson, who's one of our consultants, the godfather of stones, or his young apprentice, Mr Bolgeri, very much the Michael Corleone of the group. As you can see from this picture, the aim of the procedure is to put a plastic tube, which is called a stent, and you may hear it called a ureteric stent or a JJ stent, between the kidney and the bladder in a tube called the ureter. This is typically, in our case, done after stone surgery, but maybe to relieve an obstruction. The procedure is typically done as a day case, so you'll come in and go home the same day. It's done under a general anaesthetic, and we go up through the water pipe to perform the procedure. So there are no cuts or anything to recover from afterwards. The main risk of the procedure is infection. We give you some antibiotics beforehand, some burning when you weave for a few days, and it's best to drink as much water as you can to help flush this through. For a small risk of failure where we're unable to get the plastic tube up, and need for further procedure, either to change the tube, remove the tube, or perform a further operation, and the risk of the general anaesthetic, which the anaesthetist will speak to you about on the day. A more long-term risk is stent symptoms, which happen in about 1 in 3 patients, and this can either be mild pain on the side, a small amount of blood in the urine when you pass urine every now and then, or frequency, which is the feeling that you need to go to the toilet more often than normal. And the reason for this is that the end of the stent sits in the bladder, so when the bladder collapses it can just rub on the sidewall. And this can resolve over time, but some people do have difficulty with it. After the procedure, you'll go home once you've passed urine and you're feeling well, and we'll arrange the follow-up for you. These stents can last for up to 6 months, but if you haven't heard from us within 3 months, it's time to start chasing us, but we do keep a close eye on you. A great contact is Jenny, who's our specialist nurse, and her contact details you can see below. All of this information will be recapped with you on the day, and of course you're welcome to ask any questions, and we look forward to seeing you then.